This video is part of the surgical education series from Boston Hernia for patients undergoing an open preperitoneal inguinal hernia repair. In today's video, I'm going to talk a little bit what to expect in your first post-operative visit after hernia surgery. So you've already had surgery. It's been a month. In the first 2 weeks, you took it easy. With weeks 3 and 4, you typically ramped up your activity level, and it's now about a month after surgery. The office appointment can last anywhere from 5 minutes to 15 minutes, depending on what's going on. But most patients can get in and out within that time period. The first part of the visit will be to fill out a post-operative assessment for the Abdominal Core Health Quality Collaborative. If you've done it by email, great. If you haven't, we'll either give you an iPad or a piece of paper to fill that assessment out. We want to know how you're doing. Oftentimes there's a question on there to see if do you feel a bulge after surgery, and most patients do feel a bulge after surgery. That's normal because that's part of the normal healing. Once you've filled out the assessment, we'll get you into the room, and either the surgeon or physician assistant will come and check with you. One question that we're going to ask right off the bat is, how do you feel today, a month after surgery, than you did 2 weeks prior to surgery? That's a really important tool that we use to assess your recovery. Almost everyone feels better a month out than 2 weeks out, and if you do, it means your surgical recovery is going well and it's normal. If for some reason you're feeling worse, that's a sign of a problem, and we're going to dig into that and ask you a few more questions. But I would say about 99% of our patients tell us that they're doing better. The surgeon or PA is going to want to examine you. As one of the first things we do, we want to take a look at the incision. We're going to have you cough. We're going to check for a recurrent hernia, which rarely ever happens. But we also want to reassure you that the swelling that you're feeling is a normal part of healing. And a lot of the questions that you may have will be better answered once we examine you. So once we've examined you, and again, over 99% of our patients have a normal physical exam, which means hardness at the incision, a healing ridge at the incision, and a little bit of hardness below where the hernia was. We'll answer your questions about activity, diet, exercise, or related to surgery. Because the majority of our patients have read about the recovery on our website, have watched these videos, oftentimes they're back to doing their normal physical activity, whether it's golf, tennis, biking, running, skiing. There's very few questions, and you can expect a pretty short visit that is, however, really critical to your recovery. We want to need to lay our hands on you. If you've watched any of our previous videos about ultrasounds or CT scans, you've learned that they're not very helpful and they can be misleading, and there's no substitute to an expert surgeon's hands examining you. That's why we don't do purely telemedicine appointment. That's why we ask you to come into our office so that both we and you can be reassured that things are going well. If there are any issues in the post-operative visit, we address them. The other part and the unfortunate part is that for those of you still using traditional health insurance, oftentimes your insurance will only pay for some of the surgery itself, and so there's a lot of out-of-pocket expenses, deductibles, co-pays. Because we're a small practice owned by its clinicians, we will provide you with a bill and expect payment for the work that we've done. Just one more wrinkle, and if you're still using traditional health insurance,